I'm focused on treating the root cause of their symptoms and empowering them to be able to take control of their health again. So being able to do all those things that they really love to do and on their time frame, and showing them how they can then implement that into their own lives.
Y'all ready for this?
Welcome to the DeVerna podcast, where we talk about business, life, and how to win at both.
Well, before we get into like who you are and stuff, why don't you tell me what you do for a living and how you ended up in that field?
Okay, so I'm a physical therapist, and the whole reason I actually became a PT is because my mom's an early intervention specialist, and I was the typical kid in her classroom starting out in preschool, and I volunteered through the summers, and we used my pony in the handicap riding program. And I loved getting to watch the physical therapist interact with the kids and implement bracing and then just different types of equipment to allow them to essentially be able to function and do things that they would never really be capable of doing without them. So being able to help somebody and change somebody's life so much, it really stuck with me and touched me.
So how old were you when that was happening?
Oh, like 10, 11. Yeah. Yeah.
It had a lasting impact on you. For sure.
Definitely. It definitely did. Yeah. Yeah.
That's cool. So why don't you tell us who you are and, maybe a little bit about like kind of what your day-to-day job is.
Okay. Well, I'm actually a little bit about me. I'm originally from Van Buren, Ohio. So I graduated from Van Buren High School, got my doctorate from the University of Findlay, and I live in White House, Ohio. And day to day, I'm a concierge mobile physical therapist. So a lot of people don't really know what that is. It's newer really in the last like 5 to 10 years. So I don't utilize traditional insurance. I'm private pay, and which means I don't work for the insurance company. I work for my client and what their needs are. And I go to wherever is easiest for them to see me. So sometimes that's the office, the gym, their home, the golf course. And I'm focused on treating the root cause of their symptoms and empowering them to be able to take control of their health again. So being able to do all those things that they really love to do and on their time frame, and showing them how they can then implement that into their own lives.
That's awesome. Good explanation. So how long have you been doing the concierge side? Because that is different. We can kind of get into that a little bit.
The last year and a half, but really, I really just started it, like pushing it in the last 6 months. So started my LLC a year and a half ago and kind of started working on friends and just had a few close family referrals and friend referrals. And it's been in the last 6 months that I've really kind of started pursuing outside referrals and starting to really network and understand what it takes to build a good, strong business and a brand and all those things I never learned in PT school. So.
Right. It's interesting how little they touch on business for all businesses in college. Like attorneys are notorious for this. Like they're so beefed up on all the regulations, rules, laws, but how to run a business and how to get new people and stuff like that. It's not even a small class. It's not a small part of a class. It's not even really talked about.
100%. I really had no idea about that at all. Pretty much getting out of grad school, I was always under the impression I would be working for either a large like healthcare system or like a medium-sized like healthcare provider. That was kind of always the impression that I had, or I would be in a skilled nursing facility. I never really thought like, oh, hey, I'm going to go out and start this. Cause yeah, I didn't have the first idea about starting something like that and what it would take.
Yeah. So what what inspired you to do that then? If you had no really premonition, if you will, that this was even a thing or that you would be doing it, like what in the world changed in your mind that suddenly here you are a year and a half into something that is, very, very new to everyone, let alone you?
Well, it was actually probably about 4 years ago. I was working like 60, 70 hours a week, absolutely killing myself with paperwork. And I started actually having like numbness in my face, numbness in my hands, literally thought I was starting to develop MS. And it was from all the stress that I was under. So that was like one of the first steps that really made me look at myself. And we're these healthcare providers, and I wasn't taking care of my health at all. Like I'm giving to everybody else, but I'm not actually doing the things that I needed to be doing for myself, and just frying myself out. And really that final straw, that broke the camel's back was I was seeing some geriatric clients, and literally in a span of a month, I had 5 individuals die. And the way they passed away was just, it was extremely frustrating, and just not being able to really help them the way I wanted to help them because of the confines of traditional insurance coverage, and just really how chronic disease and geriatrics are handled in traditional healthcare. It lit a spark inside me, and I just couldn't do it anymore. I just had to make a change.
Wow. So I'm here with Breanna Barney, and we're talking about like what she does and how different it is. And I'm kind of learning about it, but to kind of give you a little more insight to the people watching and listening is that I've had a little bit of experience. Like I'm a chronic workout person, like martial artist in particular. And at 48 years old, it takes a lot of maintenance to keep everything moving in the right direction. And so she watched me walk and was like, oh, well, this is going on, and this is going on. And I'm like, yeah, that she sounds like she knows what the heck she's talking about. And so we've kind of seen each other a few times on the kind of maintenance, and she always gives me some takeaways and exercises to do and things I'm supposed to be working on. And as long as I work on those things, I feel a little bit better. And that's what it's all about for me. I think you probably have like, I don't know where I fit in the realm of who your ideal client is, because there's not that many guys that are just like me, but I'm sure there's a lot of golfers or other people that are trying to move forward and get better and at least not get worse, or how does all that work?
Pretty much, my ideal client is somebody that wants to be able to maintain that healthy, active lifestyle, but they may not have the time to do it. So that's how Concierge comes in. I'm able to go and see them at the office or at home or whatever. And it's really the individual that, hey, maybe they want to be able to work out 3 or 4 times a week, and they have this chronic knee pain, and they've been told, hey, you really can't do this anymore. You need to stop doing these things. I'm able to come in there and help them get things back on track and be able to maintain that lifestyle that they want to be doing. So really just anybody, I would say, like an active professional, a golfer, a guy that even just plays on the weekends, or someone who wants to just be able to run a couple 5Ks. And I see marathoners, I see triathletes. I really see the full spectrum. It's just that active adult that wants to be able to maintain that lifestyle and prevent injury and utilize like the most holistic approach to keep them moving and functioning at their highest level.
Mm-hmm. It's very interesting that when it comes to like martial arts and running and workouts or things that the health system kind of tells you, well, you're this old, you should stop doing that. But when it comes to eating crappy food, they don't put much focus on that. Like, that's really interesting. Like, because if the worst thing I have is aches and pains, which is generally the worst thing I have is aches and pains, like I'm doing great. Like, that's fantastic. Like, in my mind, that's just part of the process and part of the the I don't know, the part of the experience is knowing that. But then sometimes you'll get something that's a little worse, and then hopefully you can recognize that you might actually be injured instead of just kind of hurting.
100%. You know, pain is our guide to tell us that something is wrong. So, you know, really it's our environment that's kind of at fault here with so many of the problems that we have, because our joints in our body, they are meant to move for 100 years. Like, our joints are supposed to last for 100 years. And it's because, you know, we're so sedentary. We sit so much. You know, early man, we were hunters and gatherers. We didn't wear hard or super soft built up shoes. We were constantly moving. There was never a chair in sight. We were squatting, lifting, doing all these things, eating fresh vegetables, fruits. There wasn't a can of pop in sight. So it's, you know, I think the system just, you can't really write a script for fresh vegetables and sunshine. So I think sometimes for people, it's kind of a hard thing to really get into your mind, that the way to really get back to being healthy is just getting back to basics again, moving the way we were supposed to move, eating the way we were supposed to eat, and getting lots of fresh air and less stress. Yeah. Yeah.
That's good. So if I'm just kind of rehashing it a little bit, but you were in a more traditional sense of the physical therapy thing, and now you've moved to this. So, so a typical client, like if someone's listening to this and they're watching it and they're thinking, geez, I didn't even know this existed, because the truth is, until our mutual friend, my partner Jennifer, introduced us, I didn't know this existed. Like, I get massages, and that was what I considered my maintenance part, which is amazing, by the way. But to have some takeaway exercises and things I should be working on to literally take this problem and try to make it better. Like what's a typical routine? Am I the typical routine? And not that anybody knows what that is, but I see you every week or every couple weeks. Like, how often are you seeing people, and how much of the responsibility goes back to them when they're not with you?
Okay, so, you know, I'll give you a comparison to traditional therapy, because like you said, you didn't really know about Concierge. So traditionally, if you have an injury, you're going to go to outpatient therapy. They like to see you 2 to 3 times a week, from anywhere from 4 to 8 weeks. And, you know, you normally have about a 45-minute session. So when I see a client, I see them for the first visit is an hour and a half, and then all my follow-up visits are an hour. And typically, like, let's say you're coming in, you have a knee problem. Depending upon the age of that injury and your current mobility level, that's going to determine how many visits we have. And at that initial assessment, I can kind of put a plan together to determine how many visits we're going to need to help correct that issue. And typically I see people 1 time a week at a max, 2 times a week. And sometimes it's anywhere between like 6 to 12 visits. And we might see someone every week, once a week for like 4 weeks, and then maybe space it out to every 2 weeks. So there is a lot of responsibility on you as the patient, but that's also how you're going to ensure that you maintain what we gain in our sessions. And so when I'm seeing you as a patient, I'm manually helping to treat the restrictions and the mobility limitations that you have. And then I provide you with range of motion and strengthening exercises then to help you maintain those new range of motion gains, and actually help strengthen and get your muscles firing when they are supposed to be firing and working. So you can avoid those compensatory movements that we've developed because of sitting, our footwear, our clothing, our jobs, the things that we do every day.
So a typical person is getting like an hour long, like maybe an hour a week is really what you would expect as far as in person with them. And then
Yeah.
they've got exercises that they can do for just a few minutes every day. That's going to, hopefully put them in a better spot by the next time you see them.
Yes, definitely, definitely. It's small changes to your day-to-day activities that really can make a huge difference long term. So putting yourself into more of those normal positions that our hips and our knees want to be in just helps to facilitate those improvements in range of motion and proper posture. And all those things are essential to allowing your joints to move the way that they're supposed to move.
Would you really say they want to be in them?
Yes,
Like
they
they
do.
do, even though they fight it at the
They
beginning?
do.
Yeah. So you've chosen the
Yes.
concierge style. Like, why did you choose that style? I mean, you were in a whole different system, and I find this interesting. I had a client. I'll give you a second to think about that but I had a client who was a traditional doctor and had some of the same story and went to a concierge style because he just thought they were missing the mark with the way they were treating patients. I mean, is that similar? Not to lead you down that path, but is that kind of why you felt like this was the better fit for you?
100%, because I think traditional healthcare, we've just gotten away so much from that relationship with the client. And really, in order to have full, good quality health, you have to look at all aspects. You have to look at your stress, you have to look at your sleep, you have to look at what you're doing every day, what you're eating, all those things. And when I'm concierge, I'm able to see that person in their typical environment. I'm seeing what they're doing every day, I'm seeing what they're eating, and all of those things help you have optimal health. And you really need to be able to address that. And that was really my big thing with going concierge, being able to build that relationship and see what they're doing every day.
So do you do, like, when you do the therapy for people, where are you doing it at? Like, are you you have an office, you're at their place, at their office, at their home, at their, like, how does that work?
Yep, I travel, so I have a folding treatment table, and I bring all my treatment tools with me. So I'll go to the office, go to the gym, go to the golf course. Most of my clients I see at home. So go to their house, I'll see them in the morning before work, or if I'm seeing them at the office, maybe see them over their lunch break, or they have a break in between clients. That's typically where I'm seeing them at. So, yep, have all my goodies, put them in the car, bring them on in.
So you can go wherever. That's pretty,
Yep.
like, that too is very, very different, because one of the experiences that all of us have had is going to any kind of therapy or doctors or chiropractors or whatever. Like, getting there is only half the battle. You're there, and then you're just sitting there waiting, geez, like, this is time I'm not getting back. And it's different now that we have cell phones, but what are we doing with our cell phone? We're just, like, literally looking down, like, doing, which isn't that great. And one of my problems that we've been working on is, like, posture and some of that. But that makes it a very different story, like that, having the ability to go, because most of the people historically that you're talking about, generally I would say on the younger side, meaning like 60 and younger, who are active people, the schedule is an issue. Like, it's one of the reasons that I don't have hair. And it seems funny, but, like, the convenience of not having to go drive somewhere, be there at a certain time, wait in the lobby, get my hair cut, all that stuff. And it was the same thing with why I don't really go see a chiropractor and those things. Like, I don't like the inconvenience of it changing my whole day because I got to work around this thing. Like, I'm in an appointment business, so I like the idea that you have the flexibility to come to me as needed. That's a really big convenient element for me. So
Yeah, well, yeah, definitely. Because so many people that, like, the clients that I see now told me, I never would have gone and gotten physical therapy if it would not have been for you coming and seeing me. And the other nice thing about that too is, if there's issues, like, we'll just go back to the golfer, like with your golf game, and you're working with a golf pro and they're talking about, hey, I need to work on this rotation. Well, I can come out and watch that stuff and actually see what's going on and then adapt my treatment to that. So same thing with somebody who's a runner and they're like, hey, I want to start transitioning to barefoot. I want to do this. Watching them run and seeing how they're doing all those things, I can totally do that and then adapt my treatments to that.
Yeah, that's interesting. Well, I was super intrigued when you literally watched me walk and then told me things about me from watching me walk. I was like that stuff's super cool to me, that you could do that just by watching me walk for like, it wasn't 30 seconds. It was just like almost no time, like down the hall and back, down the hall. And you're like, oh, is this going on or this? And I'm like, oh my God, like that's pretty cool. So I think about like the golfers, like that would be a tremendous market, right? Like, because golfers are generally, they're just torquing their bodies all over the place over and over in the same way, right? That doesn't lead to balance. It's the opposite.
Yeah, well, and I would say so many of the people that do golf, a lot of times have jobs where they're sitting all day long too, and that impacts their golf swing. And in general, most people just can't rotate. So they're lacking that rotational aspect, which their job plays into a lot of times. But it is, so much of it is having the ability to rotate, the amount of mobility in your shoulders and in your ankles to actually be able to strike the ball the correct way. So. Oh yeah.
So that you're giving them, so a typical golfing client potentially, because I know the martial arts is a little bit outside the norm, but the golfer or the runner, for instance, like these are people that you can say, hey, work on these exercises, and then it makes it a little less painful. They're able to continue to do it more. They get a little bit better at it probably as well. Their activities that they're focusing on, right?
Yeah. So, typically the whole reason we end up with range of motion restrictions or abnormal movements is due to fascial restriction. So it's this connective tissue that covers our muscles. It surrounds our joints. It's like our body liner. And when you have like a restriction in your hip, it's typically because the fascia that's surrounding your hip is really tight. And so when I'm seeing clients, I'm manually releasing that when I'm doing the treatment. So I'm doing myofascial release, and I'm physically releasing that connective tissue. And then the mobility exercises that I'm providing are going in and then helping you actually have equal mobility on both your right and left side, and putting everything back into proper postural alignment. So we're allowing those joints to then move the way that they were supposed to move without the compensation. So it's really all about just finding that proper postural alignment, allowing for full range of motion within the joint to actually let your muscles work and fire when they are supposed to, without some type of compensatory strategy going on. It's when we start compensating, that's when we injure ourselves. And we don't really know that we're even compensating, because that's our normal. So.
Right. So speaking of like normal, like is most of who you see people that have a really extreme problem, or it is a lot of people that are using you more as a maintenance tool, or?
You know what? It's honestly a real big combination of both. So I have a lot of clients that are higher level athletes, and they see me like every 2 weeks. And like, let's say they get really sore, then maybe I'll start seeing them once a week so they can maintain their running. But then I also have clients that, for instance, I have someone right now with a rotator cuff tear that just kept progressively getting worse and worse, went to traditional therapy, wasn't working out, and I'm seeing them for that right now. So it's really kind of a combination of clients. But a lot of times they do end up coming back. So if they have a problem, they're like, hey, Bree, that's the nice thing about concierge therapy. You have my phone number, you have my contact information. Your shoulder starts hurting, you can give me a call and you can get right in. You don't have to go to the physician and have the script and then set up that outpatient appointment. You can just call me and I get you in and fix it. So
I think that's a big deal for me. Like I think of with the things I like to do, like these certain things that I have to use, whether it's the massage and the stretching and like these people and exercises. For me to be able to grapple with 22-year-olds, I have to do more work than a 22-year-old. When I was 22, I never really even thought about having to stretch out. I used to play flag football and travel all over the United States, and my stretching routine was probably about 60 seconds, and I never thought about it afterwards. And I didn't think about it again until I got back to the field to go do my stuff. So now, like the stretching and doing like the way I'm sitting on the floor and doing these, not necessarily odd, but if you walked in to the apartment above my garage, which is where my home office is, if you walked in there and watched me working, you'd be like, think I was just, I don't know what I look like. I look like I'm trying to be constant yoga guy or something, but all these movements, but you feel so much better just by paying attention to it. But somebody like me has to be told what to pay attention to and how I can help. Otherwise, you just kind of keep trudging along. And I found just in a short period of time that this is some pretty cool stuff. And it's core stuff, like stuff you can do forever on your own. Like I'm going to see you for a while, but maybe there's a time when you've given me enough tools that I don't need you until I hurt myself again, which is inevitable.
Mm-hmm. 100%. And that's really what I would love for my clients. It's, so many times we get these chronic injuries and then people, if they don't want surgery or they get surgery and then they're still having pain, or, the only option is narcotics or injections, and they're still not getting relief. It's being able to empower people on how to take back their health, on how to take back control of their life, because you kind of lose that will to persevere. And that's really my whole goal with my clients, is to be able to allow you to function and move with as well as possible, so you can be as active as possible for as long as you really can be. Because like I said, there's really no reason that we should not be able to continue to run, lift, do all these things well into our 90s, 100s. Like look at some of the Aboriginal tribes that are over in Australia, and you look at some of these guys that are 75 years old and they look amazing. And it's because they're doing all those things. They're active every day. They're not sitting in a chair. They're not eating processed foods. So they're carrying, lifting, squatting, constant movement. So really all those things that our joints and our body just want to be able to continue to function as best as possible.
Absolutely. My grandpa is 96, and he still does stuff, like physically does stuff as much as he can. Like he's down on it. He's got an Aerodyne bike. He does that. He's got these little weights. He does that. Like 96 years old, he can still drive a car. Not very well, but he can do it. And he probably shouldn't be, but you know how that goes. But anyway, and lives by himself. So like up and down stairs and those things. And I think that a big part of why he's continued to be such a healthy guy at such an older age is the continued level of activity. And we see that a lot. I'm in the retirement planning business. And so many people, instead of retiring to something, they're retiring from something. And that's just not good. Like you want to retire and have a plan to stay active and stay busy. Like they talk about how so many of us, myself included, I'm a recovering fat guy. So I think of when I was fat and I was doing this job and I was getting a little bit bigger and a little bit less healthy every year, and then having to find some things that could kind of flip that and go the other way. I don't know what everybody's going to have a little different combination. And I like the way that you have that fit to be able to adapt to whatever the client's needs are. So some people are just wanting to be able to go for nice long walks, and other people want to compete in jiu-jitsu against young people. And some people are worried about their golf game and being able to hit the ball longer and having more flexibility. And somebody else just wants to be able to golf, period. And I think that's cool. Right? So, well, is there anything else before we kind of sign off? Is there any questions I didn't ask, or things we should cover, or any notes like that? And how could people get a hold of you best would be another way.
Best way is to actually probably give me a phone call or a text. Check out my website, which is www.viptherapy.org, or my phone number 567-454-1046. And if I don't answer, just leave me a message or shoot me a text. And what I always do when I see somebody for their initial assessment, when we get that lined up, I do like a 15-minute free phone consultations to make sure that I am really the best fit for you. And so that way I also have an idea of what you're dealing with prior to coming in to see me. So, but yeah, just shoot me a text or give me a phone call, check out my website. And that really goes into more detail about all the things that I do and the services that I offer and all the forms that I need filled out, and a little bit more about why concierge physical therapy might be a great option for you.
Yeah, awesome. Good. Well, I appreciate your time, Breanna. Have a great rest of your day. And I'd say don't work too hard, but when you are doing what you like, it's not really like work anyways. So
Exactly.
awesome.
Exactly.
Well, I'm sure we'll talk soon. Thank you. All right,
Thank you. Bye.
Yeah.
DeVerna offers products and services using the following business names: Creative Financial Partners, Insurance and Financial Services, Emeritus Investment Company, LLC, AIC, member FINRA, SIPC, Security Investments, Emeritus Advisory Services, AAS Investment Advisory Services. AIC and AAS are not affiliated with Creative Financial Partners. Products and services are limited to residents of states where the representative is registered. This is not an offer of securities in any jurisdiction, nor is it specifically directed to a resident of any jurisdiction. As with any security, request a prospectus from a representative. Read it carefully before you invest or send money. A representative will contact you to provide requested information. Representatives of AIC and AAS do not provide legal or tax advice. Please consult your tax advisor or attorney regarding the situation.
Whew. Thanks for watching.